Hello and welcome to the CNBC TV18 eBix Cash Studio. I'm Shireen Bhan. India's daily COVID tally has crossed 2 lakh mark for the first time in 8 months, with 2,47,000 new cases reported in the last 24 hours. That's a rise of 64% in daily cases in the last 5 days. Now, even though fresh infections are seeing an exponential rise, hospitalization rates across metros largely stable. A large number of positive cases are either mild or asymptomatic. So let's take a look at the bed vacancy across large cities. 77% of COVID beds in Mumbai are still vacant, this according to the BMC's data. In Delhi, as per the health minister, less than 16% of COVID beds are currently occupied. Bengaluru has over 90% vacant beds, but even though hospitalization remains lower, several states have imposed strict restrictions. Delhi has banned dine-in services in restaurants and shut down private offices and allowed only 100% work from home. Tourism, hospitality, aviation and other sectors that were hoping to recover from the previous lockdowns are bearing the brunt once again. Industry bodies have cautioned the government that knee-jerk reactions will not be of help and will threaten economic recovery. In its list of recommendations to the Health Minister, the Federation of Indian Chambers of Commerce and Industry, or FICCI, has urged the government to reduce the quarantine period to 5 days to help contain staffing shortages. Hotels and restaurant associations want tourism and hospitality to be categorized as the most distressed and have sought a special relief package to enable survival. They claim that approximately 75% of industry's revenues got wiped off in FY21. About 30% of hospitality sector establishments, as per the associations, have been forced to shut, and 50% are running with losses. Well, joining me now to discuss the road ahead are the Senior Vice President of the Federation of Indian Chambers of Commerce and Industry, Shubhakant Panda. He's also the head of FICCI's task force on COVID. Also with us on the show, Pradeep Shetty, the Joint Secretary for the Federation of Hotel and Restaurants, Juzar Ghurakiwala, President of the Indian Merchant Chamber in Mumbai, and Ajay Bakaya, who's a fellow of the member of the Hotel Association of India. Gentlemen, appreciate you joining us here on the program. Shubhakant Panda, let me start by asking you first, to give me some sense of what the impact of the Omicron wave has been on industry so far. What we have seen is, while several states have imposed restrictions, some more than others, there hasn't been widespread disruption of economic activity yet. What is the sense that you're getting from FICCI members in terms of what the impact is likely to be of this third wave?
So good afternoon, Shireen. And as you correctly said, that the Omicron virus has led to a sharp increase in cases. But going by what one saw in South Africa, one can expect it to be sharp, but also short-lived. And at least the early data which is coming in indicates that most of the cases are mild or even asymptomatic, and people tend to get better in 3 to 5 days. And that is also the result at leading to very low hospitalization, which is what you alluded to in the data. So all of these are good signs. But having said that, there are some mobility restrictions in place, and that is perhaps necessary to ensure that the cases don't run away out of control. Because even with low hospitalization, if the cases are very, very high, then of course that will be a problem on the that will be a burden on the healthcare system. The sense one gets as of now, even though it's reasonably early days, is that clearly there will be an impact on the high touch point service sectors, which bear the brunt of any mobility restrictions. This is whether it is hospitality or tourism or airlines, for example. At least as of now, we are not hearing anything about disruptions in terms of widespread disruptions, as you correctly said. And beyond that, I guess more importantly, there is also a little bit of anxiety out there, and what sort of a impact that this will have. And I think we ought to draw comfort from the fact that data globally and data the emerging data out of India, what we are seeing, especially in Mumbai, is that it is something which is going to be sharp but short-lived. So brace ourselves for it. Take whatever precautions that one can possibly take. And hopefully we will be able to ride it out.
So that is the hope, that we could perhaps be peaking in cities like Mumbai and Delhi over the next few days, as per the authorities there in Delhi. The health minister saying that even today we're likely to see a number of about 27,000 plus in terms of cases, but hospitalization still at about 16%. That is the current occupancy of the total COVID beds available. Pradeep Shetty, I want to address the issue that Shubhakant Panda raised. He said that it continues to be the contact-based services, hospitality, tourism, restaurants, etc., that are once again facing the brunt of the restrictions imposed, of the lockdowns the curfews, etc. Now, the Federation of Hotel and Restaurant Associations of India have written to the government, have written to the finance minister, basically saying that classify us as the most distressed category and hence provide us with a special relief package. Pradeep, my first question to you, the government had included tourism and hospitality as part of the ECLGS program, which was announced as the relief package last year. Has that alleviated some degree of the pain? And what is the impact of the current restrictions on the business so far?
Hi. So, yes, I agree that ECLGS at the start was extended to all MSMEs. Then thereafter, it was expanded to bring in the tourism sector. What happened was by that time, most of the funds were utilized. By the time in the third round, I believe that is when tourism was bought. That is ECLGS 3. And mind you, very few, the scheme actually could not be implemented because of lack of funds and lack of apathy from the financial institutions. And I'll tell you why. Because after this was almost when the second wave came in by that time. So financial institutions have clearly developed an aversion towards this sector. So because they see that this is going to be the sector which is going to be the first affected, the first victim, so therefore no funding. So despite of that measure, nothing really came out much out of it. That is one. Second point is that what is really happening with these is that it is ECLGS is only extending additional funding to an operator or an owner who already has a debt exposure with a bank. So what precisely it's doing is enabling us to take more and more loans, is more of borrowing, making availability of more funds. But again, the problem is of repayment. So in successive lockdowns, there have been shutdowns. In Maharashtra Classic's case, in first wave, restaurants stayed shut for 10 months. Hotels were affected for like almost 6 months. And thereafter, with skeletal services, international arrivals didn't happen, domestic tourism didn't happen, no corporate movement happened. Second wave for about 4 months. What happens is, I have a loan and you put more money into the hand by way of another loan. And again, that has to be repaid within a year. I mean, that's within a year. That's the difficulty. It doesn't really end up alleviating the problem. It has only added to the problem. So therefore, your question, that's exactly what.
Okay, so you're saying that the ECLGS scheme has not worked for the hospitality and the tourism sector because you're dealing with a cash flow issue on account of restrictions, and in fact, taking on more debt at this point in time is only aggravating the existing situation. I'll come back to you on what the specific recommendations are, what the intervention is that you seek from the government in a second. But let me get Mr. Khurakiwala into the conversation. Mr. Khurakiwala, you represent the merchant chambers in Mumbai. We're getting closer to the budget. While we see the Omicron wave play itself out, state governments are reacting to the current situation by way of restrictions. The Maharashtra Chief Minister said that there is no question of a lockdown. So while there are capacity limits and so on and so forth, businesses continue to be open. What are you sensing at this point in terms of the economic impact of this wave?
You see, thank you, Shirin, for having me on your show. Though there is no formal lockdown in Mumbai, but if you go around Mumbai today, it's a complete lockdown. There's not a soul in sight as far as Mumbai is concerned. So this whole issue of hybrid lockdown, as we could call it, it does not help either way. The trains are on, the offices are partly shut, government offices are partly shut. So the whole impact of a lockdown, the impact comes on the economy. My sense is that hospitalization is the major indicator for suggesting a total lockdown. Currently, we have, as you mentioned earlier, 75%, 80% beds are empty in Mumbai. And Mumbai has done a remarkable job as far as the Delta variant was concerned through our municipal commissioner, Mr. Iqbal Singh Chahal. I mean, it's a marvelous job that he has done when we have never seen bed shortage or oxygen shortage or crematorium queues. So I think this hybrid lockdown doesn't help the economy at all. The second most important thing that we miss is children who go to school. For 2 years, children have not been able to go to school. And this is
Yeah.
something that while we keep offices shut, we keep offices open, we don't allow schools open. I think this is something that a government should really look at, because there's a lot of trauma and mental issues which go on with the parents as well as with the children. So I think this is one area which I think they should. In America, they say schools should be the first to open and last to shut. So I think
Yes.
this is something which the government can look at.
You're right in pointing that out, Mr. Kurakiwala. In fact, that is what the WHO has maintained as well, that school closure will have a long-lasting impact, and that should in fact be the last resort. Mr. Bakaya, thanks very much for joining us. I want to come to you. We just heard there from Pradeep Shetty saying how the ECLGS scheme has not really helped the tourism and the hospitality sector much, because there's a cash flow issue or the lack of it that the sector is dealing with, and taking on more loans is not necessarily the best way forward. You know, just if you could give me a sense of what has happened on the ground on account of this current wave. We understand that the previous two waves have broken the back of the sector, and just as we were starting to see a recovery, we've now had to deal with Omicron and the restrictions. What has been the impact of on the ground so far in the last few weeks?
Shirin, till December, we did not see any significant impact. January, we're seeing a dramatic impact. So I would say that in January, most of the industry is going to see 50% of projected revenues. And we expect this to continue till February, probably a similar sort of impact, and then get back to normal closer to March. Shirin?
Okay, so you're anticipating, you know, some degree of normalcy, and of course a lot will depend on how the virus plays itself out. But January and February will be, or will continue to be, challenging months for the hotel and the hospitality sector. Shubhakanta Pandey, I want to come back to you now with the specific recommendations that FICCI has made to the government. I remember even through the first and the second wave, you know, CII, FICCI had put together this economic matrix on what should be allowed, what should be curtailed, when should you know, activities and movement be curtailed, and so on and so forth. In light of where we are today, especially when it comes to vaccination, what is the key recommendation that you want to make to the government, besides bringing down the quarantine period further to 5 days? We've already seen a cut. Now it is 7 days in India. In the US, the CDC has brought it down to 5 days. You're seeking 5 days here as well. How much of a problem are you facing in terms of staffing and shortage on account of a 7-day quarantine?
So a couple of questions in there, Shirin, and I'll respond accordingly. First of all, as far as key recommendations are concerned, based on the discussion of the COVID task force of FICCI, one thing we have sought is to bring down the quarantine period, especially for those in home isolation, from 7 days to 5 days, because again, the data seems to suggest that most of them are getting better in 3 to 5 days. And, you know, I mean, 2 days might sound trivial, but it can make a big difference to the daily wage earner. It can also make a difference to, particularly, for example, the medical sector, where, I mean, if people are out of, key personnel are out of action for that, that additional 2 or 3 days. So that is one thing. Besides that, in terms of other suggestions, what we have said is to expand the precautionary dose program to the general adult population. I mean, India, I think, has done a good job in terms of methodically opening up the vaccination process, which is one of the great success stories. And while we have started out with the precautionary dose for healthcare workers and the elderly with comorbidities, our recommendation is that sooner rather than later, it needs to be opened up to the general adult population, and similarly to the school-going children, which is 12 plus. But to talk about the economic activities matrix, I first wanted to take you back to, in fact, middle of last year, when the second wave was at its peak and easing up thereafter. We had suggested something called the unlock matrix, which comprised of 4 categories from minimal risk to high risk based on positivity rates. Now, given how transmissible the Omicron variant is, the 2 clear things which come out are, first, that contact tracing is something which will have diminishing returns because it's an overwhelming exercise. And secondly, that positivity rates are not the appropriate metric this time around to look at economic activities. So as opposed to the unlock matrix, we are calling it the FICCI matrix for economic activities, similarly categorized into four categories: minimal, low, medium, and high risk, but based on two factors. The primary factor is the occupancy of hospital beds, because that is the most critical factor. And secondly, just as a thing on how additional factor could be the number of cases as compared to the second wave, because again, if you look at it crudely, hospitalizations are roughly 1/4. So you should start worrying if the cases are sort of double of what they are the previous time around. But two critical changes this time around, that we are recommending not to make a distinction between essential and non-essential, because anything which is produced and consumed is essential to someone. And secondly, that given the success of the vaccination drive in the country, an overarching condition that if a unit has 75% of its workforce fully vaccinated, then no restrictions should apply.
Yeah.
So that is how we're looking at it.
Yes, those are the key differences between the plan that you would put forward post the second wave and what you are suggesting now. The focus needs to be on hospitalization rates as opposed to positivity rates and just focusing on the absolute number of COVID positive patients. Pradeep, let me come to you now and ask you for specifics, because what you have said is that a special relief package is needed to ensure the survival of this sector itself. Prioritize for me, what is it that the ask is of the government, especially in the context of the upcoming budget?
So let me start by giving you four statistics which are very, very relevant to answer your question. One is that this sector, the tourism sector as a whole, and the hospitality almost employs about 50 million people in this country. It contributes to about 9% of the GDP. 2019 to 20, the revenue from this industry was close to 2 lakh crore. And almost 70% of it was wiped off in the first round and the second round. So, having regard to these startling figures, one has to understand the importance of this industry. And one other critical aspect is what is happening to this industry, which holds key to infrastructure in the country and also key to so much of employment and revenue generation. The admissions to hotel management schools have fallen by almost 60% this year. This is going to create a serious problem in the future, more because the two successive rounds of lockdowns where employees have been laid off, owners have gone bankrupt. You showed the numbers of units have shut down. Only good sound companies have been able to survive, because there were two successive lockdowns to come out of it. It's not easy. And now we have the third one. Now, how do you mitigate all of these and ensure that this industry flourishes, and industry from which you earn so much? So therefore, a necessity to distinguish the most affected sector amongst the effects of this pandemic. So in the first round, the government said, and which we appreciated, that there was the enormity of the problem was so much that there were too many people affected by it. So, what can I do? So what did the government do? They extended help to all borrowers, and there were resolution frameworks. Then there were loans and given out, working capital loans, etc. All of that were laudable efforts, and those were appreciated. But that's not going to be enough for an industry which is on the threshold of being wiped out. 50% of them will be wiped out. And mind you, it is more to do with the smaller segments, small hotels, standalone units in second cities, third cities, last cities. Where this being a capital lender.
No, I get that, Pradeep, and I don't mean to interrupt you, because I know you're giving us a sense of the scale and the magnitude of the problem, but unfortunately we are running short on time. So if you could just tell me now, in terms of specific intervention, what is it that you seek?
So one is that the last time they announced a 60,000 crore fund for this industry, which was going to be cheaper available funds for a longer duration of time. Now that has been announced but not operationalized, so that requires to be done. And now, of course, it needs further changes so that it becomes as a soothing balm rather than a additional pain. And additionally, there has to be employee feedback support. There is an ESIC fund with some thousands of crores available with the government that can be used to pay these employees who are being affected or laid off, so that this industry is not facing dearth of manforce in the future, and some direct relief to the owners everywhere, wherever they want to come back to business and restart. These are the three vital points which we are asking for, which is to answer your question.
Right. Thanks for that, Pradeep. Mr. Bakaya, would you like to add to what we just heard there from Pradeep in terms of what intervention is now necessary on the part of the government to, in Pradeep's words, ensure that this sector is not wiped out?
Yes, Shireen, I'd go beyond the band-aid solutions we've been asking for the last couple of years and not getting very far with. I think looking forward, and I'm sure the state is looking forward on how to be fair to this industry or how to revive this industry. Two critical factors. One, much talked about in the very recent past, is giving the hospitality industry infrastructure status. That helps us in future developments. That helps us in terms of longer term bank loans, et cetera. So that's a big factor. Second thing, something we've been asking for a very, very, very long time is to be recognized, tourism to be recognized as an industry. Now, it's a state subject, can't be done unilaterally at the central level, but it's an agenda item that we've been pushing for a long time. And we want beyond the recognition as industry, but actual benefits in terms of energy costs, our power bills, and other similar features. Those are two key factors, given the fact that the budget is almost upon us. Thank you.
Yes, let's see if some of these factors are taken into consideration, if there is any special relief package that is announced. The Finance Minister did say that this is a sector that has been hit and will perhaps require some support. But Mr. Khurakiwala, I want to end by asking you, we are headed into the budget. The expectation is that not just stimulus, but there could perhaps be additional relief measures for sectors that have been impacted. What would you like to prioritize? The three items that you would like the government to focus on?
In terms of the three items that you mentioned, the first is the ease of doing business. What I mean by, when we talk of ease of doing business, it is always at the macro level. But when any policy decisions are taken at the center, it is the state that implements at the local level, and that it becomes very difficult at the state level to get the ease of doing business. So I think that is one area which the government should look at. It doesn't trickle down to the touch points that the industry has with various agencies in the state that it operates. The second issue is the compliances. A lot of issues are there on compliances. Take, for instance, TCS and TDS rates. There are 50 rates in TCS and TDS. There's so much of compliance issues that come in the wake of. The third is in terms of infrastructure. The whole issue of infrastructure development is, I think, more capital infusion is required, because the capital to GDP ratio is going down, and that's the third area which I would recommend to the government.
Yes, that is a long-standing ask, and of course what we have seen through the course of the last few budgets is that it is the government that will need to continue to do the lion's share, the heavy lifting when it comes to capex on infra spending, because the private sector investment cycle is yet to take off. Pradeep Shetty, Shubhrakanta Panda, Ajay Bakaya and Mr. Khurakiwala, appreciate you joining us here on the Business Centimeter to take us through the impact of the Omicron wave on economic activity and the economy, as well as the expectation from Budget 2022. We will take a break. There's a lot more coming up. Don't go anywhere. We're back in a moment.